Good afternoon, everyone, and welcome to COVID in the House of Old. My name is Stephen Collis. I'm a professor in the Department of English at SFU, and I will be your host this afternoon. I also currently have COVID-19, so apologies if I begin coughing or anything like that at any point today. I'll try my best. I'm surrounded by different liquids that will hopefully keep me speaking. I'm going to begin with a special land acknowledgement that was prepared by Megan Davies, whose project this is, and we're here to engage with today. This project has taken shape while working on the traditional territories of many Indigenous nations. Project lead Megan Davies is based at York University on an area known as Takaranto, which has been taken care of by the Anishinaabe Nation, the I'm obviously not from Ontario, the Haudenosaunee Confederacy, the Wendat, and the Métis people. The project has also been worked on during time on Comox First Nation land and the lands where many of us today are gathered, the unceded territories of the Squamish, Musqueam, Tsleil-Waututh, Coquitlam, Kwantlen, Kaikite, Katzie, and Tawasin peoples. We acknowledge what a privilege it is to live and work on these lands. Megan has pointed out that an ideal long-term care system would follow the ethos of the Great Lakes region's dish with one spoon wampum belt covenant, a wise agreement that honors equitable, healthful, and sustaining life for all beings. With one dish, we would not have long-term care facilities where residents were being neglected and negated, workers underpaid and unsupported, while owners of for-profit facilities, so Megan has heard, drink champagne together at conferences at Whistler. We're going to begin first with a few words from SFU's President, Joy Johnson, who I will now introduce. Joy Johnson is President and Vice Chancellor of Simon Fraser University and professor in its Faculty of Health Sciences. As president, Joy is committed to enhancing student learning experiences, working towards Indigenous reconciliation and advancing equity, diversity, and inclusion across the university. Prior to her appointment as president, Joy served as SFU's Vice President Research and International from 2014 to 2020, where she oversaw the evolution of cutting-edge research, innovation, and international engagement across 8 faculties. But prior to SFU, Joy has had a distinguished career in academics and research. She completed her PhD in nursing at the University of Alberta and joined the University of British Columbia as a professor in the School of Nursing. Her commitment to research led her to the role of scientific director with the Canadian Institute of Health Research's Institute for Gender and Health. Sorry. Please welcome Joy Johnson.
Well, thank you ever so much, Stephen. It's such a pleasure to be here. And I just want to begin by thanking Hiroki Tanaka for that opening piece. It was really, really moving. So thank you ever so much. I want to acknowledge the land that I'm on today. I'm in Vancouver on the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people. And I want to pay my respect to elders past and present. I am really very, very pleased to be here today and join all of you and to celebrate this incredible work. We really are very, very honored to welcome the SFU Shadbolt Fellow, Professor Megan Davies, and her collaborators in the COVID in the House of Old project to share with us stories of how COVID has impacted the lives of Canadian elders living in long-term care homes. I think we all can agree that the current pandemic has revealed systemic problems in our elder care system. An absolutely unacceptable high rate of COVID-related deaths among elders living in long-term care facilities, for example. Many elders, as we know, have died alone, without their family, without their friends, and often without palliative care. In many cases, the increased dependency of seniors on their caregivers has led to increased financial, physical, and verbal abuses. And this is unacceptable. And nobody has been held accountable for this incredibly disastrous outcomes. So I think we can all agree it's time for our society to acknowledge this suffering and to take action. so that we make sure that there is appropriate care for loved ones and that loved ones can heal from these ordeals. I believe that as an educational and research institution, Simon Fraser University has a role to play in continuing to inform policy and decision-making as we address the heightened significance and deleterious consequences of the pandemic on older people. I'm so pleased that our Gerontology Research Center has pivoted to address the structural system-level context of the pandemic and the individual level risks and experiences and responses. COVID in the House of Old is one of the first public commemorations of the pandemic that brings to light the stories of this national humanitarian crisis. It's bringing it to light for Canadians, and it's calling us to action. I want to thank the Jack and Doris Shadbolt Fellowship in the Humanities. I want to thank SFU's Department of Gerontology, and I want to thank York University as well. I want to thank your Faculty of Liberal Arts and Professional Studies for your support for this really important project. You know, it's a great pleasure as a president to get exposed to this kind of work. And as someone who has an 86-year-old mother and a healthcare background, I couldn't be more pleased to be joining all of you today. I also want to thank Isobel MacKenzie for her tireless advocation for seniors, so important. It cannot be more appropriate that Isobel, a dedicated activist from BC Seniors Advocate, is speaking at this inaugural event, because the BCSA is a unique organization in Canada that's been advocating for seniors across a broad spectrum of issues. I want to thank Professor Megan Davies and your many collaborators, Hiroki Tanaka, Bernadette and Antoinette Cheung, Kim Fraser, and so many more. Thank you for creating this exhibit to tell these important stories and to let the voices of the weak and the vulnerable be heard and let their sufferings be seen. I want to thank everyone for making this happen. I hope you enjoy this program. Thanks so much.
Thank you, President Johnson. One of the hats I wear at Simon Fraser University is that I help coordinate the Jack and Doris Shadbolt Fellowship in the Humanities. The Jack and Doris Shadbolt Fellowship program exists to promote the practices of and approaches to the humanities and arts, broadly conceived, as important sites of creative and critical engagement with the major concerns of our times. So being able to support Megan Davies in this project is, as you would say, right up our alley. But before we get to Megan, I do want to introduce Hiroki Tanaka. That he was just mentioned by Joy as well. It's Hiroki's music you were listening to as you came in and joined us this afternoon. That piece is called Elegy for Long-Term Care Homes 2020-2021. Hiroki Tanaka is an artist living in Toronto. In 2020, he released his debut solo album, Kaigo Kyoku Kyoku, Caregiving Memory Songs, based on his experience as a caregiver for his grandmother with Alzheimer's and his uncle with terminal cancer. Please welcome Hiroki.
Hi, everyone. Thanks for joining us for this live launch of the project. It has been many months in the making, and I'm super honored that Megan invited me to work with her on this project. When I sort of came up with the idea of representing the data from long-term care homes, Megan sort of took to it immediately, and we really sort of just hashed out over time how this would work. And I'm super excited to present it to you now and to really see it and see how people are responding to it, because it is meant to be a partner piece to the chairs and the stories that Megan has collected. I really want you to listen to the stories of each individual and to then look at my piece and to see those individuals reflected in each and every dot. Just as a quick summary, I took all the data from the long-term care home deaths that occurred between March 2020 to October 2021, and the deaths from Ontario are the orange dots that are moving from left to right, and the deaths from BC are the green dots moving from right to left, and each dot is accompanied by a musical note. And my hope is that you'll be able to reflect and to mourn and to think about those lives that were lost.
Thank you, Hiroki. I believe that Hiroki's piece can be found on Megan's project website, which I think has probably already gone in chat, or will definitely be going in chat at some point this afternoon. I should also have mentioned that we will have a short Q&A towards the end of the hour. So if you do have questions at any point, just use the Q&A function you'll find on the bottom bar on your Zoom screen. You can put your questions there, and we will turn to those towards the end. Thank you very much. So it's my pleasure now to introduce Megan Davies. I can find the right piece of paper. Megan is a 2021 Jack and Doris Shadbolt Fellow in the Humanities at Simon Fraser University. She is a historian of health and with a regional focus on BC. She currently works on old age, madness, and everyday medicine. As part of the madnesscanada.com community, Megan has participated in a number of academic community collaborations, most notably the 2013 documentary, The Inmates Are Running the Asylum. In January 2022, with the support of a Shadbolt Fellowship, Megan launched COVID in the House of Old, a public exhibit, website, and podcast we are here to hear about right now. Please welcome Megan.
Thank you, Stephen. Good afternoon, and thank you to everybody for coming to this launch. And I can see that there are now 211 participants, and that like only 7 of those could possibly be my siblings. So thank you. So I'm just going to start with my PowerPoint. %82 of all Canadian deaths in the first wave of the pandemic were long-term care or nursing home residents. That's an extremely high statistic compared to other nations. In Australia, it was 28% and 31% in the United States. These numbers didn't surprise me, but they were so wrong. Over the summer of 2020, I started to think about the human rights aspects of the extended isolation of the residents. And of course, I was already aware of the chronically poor working conditions for long-term care staff. I'm an academic, but I wanted this to be a public project. I wanted it to be a kind of past, present, future perspective. And I was so fortunate to get the Shadbolt funding. We have created a website, an exhibit website, and a traveling exhibit that will someday, hopefully March, actually open at Kwantlen Polytech University. The idea is that then it will tour libraries and other public spaces, and I invite you to contact me if you have a location in mind. At the heart of the exhibit are 7 storytelling chairs that tell of 7 lives that were altered by COVID and long-term care. It was important to me to present these as whole people, not just victims. And I did interviews for each chair to gather stories. And I'm now going to give you a taste of these powerful narratives. A beloved husband, father, and grandfather, Bob died of COVID at Lynn Valley Care Facility in April 2020. And here is a little slice of his narrative.
Him dying the way he did, that's what haunts me about my dad. His start in life was not a great one. Being on the outer edge of any sense of belonging in his life, for my dad to be kept from the people who loved him the most, to die alone, it was very, very cruel.
A former secretary, mother, and grandmother, Maggie died of COVID at Wellesley Central Place the same month as Bob.
I liked the setup they had at New Horizons. You walked in and it felt like you knew this was Grandma's home. At Wellesley Central Place, it was more of like a hospital room. Wow, this is depressing. She wasn't really eating, but if I took her out, I'd be like, do you want to choose a donut? And they were the most insane, elaborate donuts you've ever seen. And then she'd like, really? She'd get all excited, and she never passed up dessert.
Moon, who loved bingo, volunteering, and her family, died of COVID at Little Mountain Place in December 2020.
Everything of her love came from her hands, because it was the food that she made, the clothes that she sewed, and of course, just holding her hand too. She's very much a physical touch person, and even when we were just sitting, we would just grab her hand and hold on to it, and she could give it a squeeze.
Karen was a member of the Squamish First Nation and a resident at Hilltop House. She passed unexpectedly in November 2021.
After, I think it was a year, my son was allowed in, the only one allowed. I just remember seeing him coming in the door, and I thought, oh, you think he was on another planet? I thought he was going to break my neck, hugging me so tight. Well, we weren't supposed to hug, but we did. That was a tough year.
Jacobus left a long-term care facility in Ontario in July 2020 and went to live with his daughter in rural British Columbia.
So we would visit him, the glass-to-glass visits. He's hard of hearing, so...
They would never let me visit alone, even through glass.
You could see the frustration building in him. Felt locked up. You know, he'd be asking what was going on out in the world. This was like the Second World War.
Esther is a care aide, a PSW, in a Toronto long-term care facility. She nursed residents with COVID in the first wave.
Some residents want to converse, have a talk with you, but you don't have that time because you're short-staffed. That is the worst part. You feel you've not connected because you don't have the time. Yet when you're doing care, when you've connected with them, it's really so sweet, and so you feel in your heart, this is the best day ever.
And our final chair will hold the stories of Wikwemekong Nursing Home on Manitoulin Island, unceded territory, but when it's safe for us to go there. Finally, I'm going to give you a little listen into our project podcast. It's available on our website and on Google, Apple, and Spotify. And I want to, at this point, give a shout out to its talented creator, Cohen Hammond.
The sheer number of people who were lost each have families and lost connections and went through, quite frankly, what sounds like a terrible death. People talk about how their lungs feel like they're on fire.
A lot of immigrants come here and their qualifications are nullified. There's care work. That's why a lot of immigrants are in it, especially women. It's not a job that pays well, but it's a fulfilling job in that you're helping somebody.
For that reporting to have not evolved at all over the course of the pandemic was unacceptable, shocking, a disaster, a complete abdication of the role of the press in this country.
We spoke with one gentleman. He hadn't seen his wife for 4 months, and she had dementia, and he could try and see her through the window, but she wasn't necessarily able to process that. And her condition deteriorated rapidly. When he said he was suffering from intrusive thoughts, he couldn't stop thinking about her, worrying about her, and felt very helpless.
COVID-19 made Canada
the ultimate grim reaper among the nations of the global north, because 82% of our first wave deaths were vulnerable, elderly residents of long-term care facilities. And yes, you do need to know more about this. Reviewing the pandemic's first 20 months and delving into a broad spectrum of elder care issues, host Megan Davies talks to an eclectic cast of characters. A journalist who set out to keep a tally of deaths and ended up a GoFundMe star. A nurse in charge of infection control at Toronto's largest public care facility. A resident who rebelled against being shut inside. A sociologist who spent a decade searching for the best in elder care. And a public artist committed to moving grief out of the Kleenex box and into the community.
Of course, I really just did the podcast to impress my son. But honestly, I love doing all of this project, and I'm so deeply grateful to the project team, to the families that spoke to us. Some of those were difficult conversations, and I admire them, and I was honored to be there. And also all the people that made it happen in so many different ways. Thank you so much. And on the screen in front of you, you have the website address and the project email. We'd love to hear from you. Thank you.
Thank you, Megan. The website address has also been put into the chat a couple of times. If you can't find it easily, there it is. So we're moving on now, and the next part of our discussion will involve three panelists. These are all three interviewees from Megan's project. I'll introduce all three of them and they'll join me here on screen. First, we have Kim Fraser. Kim Fraser is the executive director of a community health center in Toronto. For the past 16 years, her focus has been on primary community care, health promotion, and community support services for at-risk and marginalized groups. Kim's mother died of COVID-19 early in the pandemic on April 16th, 2020, at the long-term care home, Rikai Wellesley Central Place in Toronto. I'm sorry, Kim. Kim is pleased to be part of the COVID in the House of Old exhibit because she wants to honor her late mother. Kim also believes that the exhibit will bring awareness to the indifference, neglect, and deep sadness that many of our elders in long-term care experienced during COVID and continue to experience today. Next is Bernadette Chung. Bernadette Chung is a CPA who specializes in building financial reporting functions for hypergrowth startups. Her grandmother was one of 41 victims of the COVID-19 outbreak at Little Mountain Place in December 2020. The trauma from this loss propelled Bernadette to speak openly about the failures of long-term care in BC, and she hopes to continue bringing attention to this issue until tangible reform is achieved. And Bernadette's joined by her sister Antoinette Chung. Antoinette Chung holds an MPH from the University of Manchester and works as a researcher in the field of health economics. Her grandmother, again, was one of the 41 victims of the COVID-19 outbreak at Little Mountain Place in December of 2020. I'm sorry to both of you for your loss. Influenced by her grandmother's decades of giving back to the community as a dedicated volunteer, Antoinette serves on the board of the Planned Lifetime Advocacy Network to support its mission of building an inclusive community for people with disabilities. Welcome, everyone.
I guess we can go first. Good afternoon, everyone. My name is Bernadette Chung, and I'd first like to thank Professor Davies for her interest in my family's story and for including us in her project. My sister Antoinette and I lost our grandmother to COVID-19 in December of 2020. Granny was one of 41 residents who passed away as a result of the outbreak at Little Mountain Place. At the time, our family was shocked and we couldn't comprehend how it could have happened. How did the virus infect almost 90% of residents in the span of a month? Yet the facility's management couldn't provide clear answers as to what went wrong. It was as if they were too busy sanitizing their words instead of sanitizing the facility. We were angry, and no one was talking about this outbreak during the provincial COVID briefings. This frustration led me to reach out to the media, and I'm grateful for the numerous reporters who covered the story and brought the issue to light. But we're still nowhere closer to finding answers, and in fact have realized that sadly, the Little Mountain story is not a unique one. The more we researched the issue, the more we realized there were weaknesses in the long-term care system that pervaded well before the pandemic. And even though Granny is no longer with us, we want to honor her memory by spurring our anger into action and to remembering her, not by the tragic way that she died, but by the loving way that she lived. We are inspired to be here today because of who Granny was, not just to us, but also to her community. Before her dementia had set in, Granny was an active volunteer at the Raycam Cooperative Center in Chinatown for over 20 years, preparing daily meals for the childcare program there and leading the Chinese seniors program, including as their chair. Her dedication to giving back drives us to continue looking for ways to better our community and honor her legacy. As Granny was never one to shy away from the spotlight, we are also convinced that she would be delighted to be part of this exhibit, especially if it is a step towards enforcing real change in the delivery of care at facilities like Little Mountain Place. Our experience with Little Mountain highlighted not only the gaps within long-term care for mounting an effective pandemic response, but also gaps in the day-to-day care for residents. While we are grateful for the work and compassion of the staff there and appreciate the incredible challenges they had to deal with, we never got the sense that the long-term care system itself prioritized the needs of residents at the individual level. To think that Granny, who thrived on social interaction and the physical closeness of others, had to endure months of isolation, that completely shatters us. We had no indication that efforts were made to bring her comfort in the absence of family. In fact, when pressed for information about the situation during the pandemic, we were told that the one social worker who spoke Cantonese had left the facility. So Granny didn't even have someone who she shared a report with to speak to about her needs. We recognize that there is much to be done to bridge these gaps, but we are hopeful because of all of you here today as allies. Along with this exhibit, a petition has been launched to ensure that the long-term care system in Canada is transformed in a meaningful way, and we encourage you to access and sign it through the link that will be shared or has been shared already in the chat. Thank you to all for your support and allowing us to share our story.
Okay. Thank you, Megan. Oh, sorry, can I go? Thank you, Megan, for involving me in this project. It is an honor, it is to honor her memory and as an expression of love that I speak to you today about my mother, Marjorie Doreen MacKenzie Fraser, known as Maggie to her friends. And I'm also here to acknowledge the pain and loss that families have gone through and continue to go through during this pandemic. My mother's life was bookended by catastrophic world events. She was born in 1929, a month before the stock market crash that started the Great Depression, and she died 1 month after the WHO declared the SARS-CoV-2 pandemic. Maggie was born and raised in Toronto by parents who immigrated to Canada from the West Indies. Her career was as a legal secretary, and she was especially proud to have worked in the law office of Judy LaMarche, the former Liberal cabinet minister responsible for the legislation that brought in the Canada Pension Plan and Medicare. After she retired, her happiest years were when she lived in the Older Women's Network Housing Co-op in the in the St. Lawrence Market area of Toronto. There she convened social events for the community and volunteered for several community organizations. Maggie was a bright, spirited, and caring person. She could be hilariously funny and had a terrific sense of humor. She was close to her family, devoted to her grandchildren, and delighted to become a great grandma to Rosalie in 2017. As she aged, she developed dementia. When it became apparent that she could no longer live on her own, she moved into the New Horizons retirement home, where she lived happily for 6.5 years until she needed long-term care. In July 2019, she moved into Wellesley Central Place long-term care home, where she died from COVID 8.5 months later on April 16, 2020. In her obituary, I wrote she died peacefully. That was certainly wishful thinking on my part at the time. We now know people die a lonely and horrible death from COVID. I naively believed that the long-term care system would protect her, but how could it? Even before COVID, it was historically understaffed and under-resourced, a perfect storm for a tragic outcome. 22 months later, Omicron is showing that not enough has changed in long-term care. My friend has a friend working in long-term care. The long-term care worker recently texted my friend saying, "Staff are dropping like flies here. We have no gowns. Our sickest residents with COVID are coughing up blood. Our other residents are confined to their rooms 100% of the time." I ask you, after all this time in this pandemic, how is it even possible that we are back to where we started? What will it take to fix long-term care? Is there the political will to do so? And what can we as families, loved ones, advocates, and policymakers do to protect our elders and ensure they live with dignity?
Thank you, Kim, Bernadette, and Antoinette. That was very moving. We have another speaker coming up, and I'll introduce them now. That's Isobel MacKenzie. Isobel MacKenzie has worked widely, recognized for her work with which comprises over 20 years experience with seniors in home care, licensed care, community services, and volunteer services. She has led BC's largest not-for-profit agency, serving over 6,000 seniors annually. She led the implementation of a new model of dementia care that has become a national best practice and led the first safety accreditation for home care workers, among many other accomplishments. Prior to her appointment as the seniors advocate, Isobel served on a number of national and provincial boards and commissions, including the BC Medical Services Commission, the Canadian Home Care Association, BC Care Providers, BC Care Aid and Community Health Worker Registry, and so many more. I'm not going to actually list them all. It's quite impressive. Welcome, Isobel. Thank you for joining us.
Thank you very much, Stephen. And I am speaking to you with great humility from the First Nation lands of the Lekwungen-speaking people of the Songhees and Esquimalt First Nations here in Victoria, BC. And it's my great pleasure to offer some insights and some commentary on this amazing project that has been undertaken by Megan and her team. I want to thank profoundly those individuals who contributed their unique stories to this project. They really bring to life the experience. And while I would like to think that those were the only people who experienced the kinds of hardships that they are describing, the reality is, and certainly the daughters from, or the granddaughters from Little Mountain spoke to this, it actually reflects a very prolific experience of many people, many families, many residents across the spectrum. So I thank you for sharing your stories. And I really want to thank what have we got here? The about 200 of you that have joined in to show your interest and support for this project as we've shifted to our virtual world. It has some virtual gatherings can sometimes be beneficial. You can get some people you wouldn't otherwise get, but oftentimes they can also marginalize people who can't engage virtually in the way they can in person. So I thank those who've joined this virtual event, and I'm hoping that we will have an opportunity to meet again in person at some point in the near future. You know, as I reflect on the last 2 years, and particularly around the impact of COVID-19 on seniors, and especially on long-term care, and what we've done and how we've reacted, and the best of intentions that have not met with the results that people had anticipated. I was reflecting back, and Stephen, as an English professor, you'll appreciate, I normally obviously prefer to quote Robbie Burns for obvious reasons, but I'm going to go south of Hadrian's Wall. And, you know, Tennyson, Alfred Tennyson, and this has always stuck with me for many, many years, even before I assumed this role, from Ulysses. And it's a passage, how dull it is to pause, to make an end, to rust unburnished, not to shine in use, as though to breathe was life. And those words, written over 100 years ago, are part of the foundation of why we experienced what we experienced in long-term care across Canada, and arguably in other parts of the world. And yes, there are aspects of the system that are tragically flawed, and they were flawed before COVID. And yes, those issues are around the people we entrust to care for the elderly in our society are some of the lowest paid workers in our society. And what is that message? And some of the places where we want the older people in our society to live are older and more decrepit than many of the government office buildings or the banks. But when you distill it down, you realize that really what we're saying is to breathe is sufficient, that we're going to keep you breathing, and that's our goal, because that's at your point in this Shakespearean arc of life, that's sufficient. And I think we have to step back and say, no, I may be 98 years old, but I want to see my family. It is really important to me. I know I am aware of my surroundings. They matter to me. I don't want to be put in a room with a roommate that is not somebody I have chosen to live with. If I want company, I can go outside my door, and there's plenty of company. I appreciate that you're trying to keep me safe, but my life will end, as all of our lives will end at some point. That will never change. The only thing we can control is how we live the years we have. And as we age, we surrender certain controls to the aging process. It's different. Different people age differently. Milestones are reached at different age in individuals. We can look at, a trajectory of probability based on what's most likely to happen at what age, but we do slowly move a little less quickly, see a little less well, hear a little less well. We still can think. We may not think as quickly, but we still can think. And things we were able to do for ourselves, sometimes we're not as able to do them anymore. But when we move into long-term care or nursing homes or whatever we want to call it, we surrender a tremendous amount of our personal autonomy, but not all of it. And we lost that fact. We lost the fact that this was people's home, wasn't the hospital. They weren't in there to be cured and fixed. You go to the hospital to be cured and fixed. People move into nursing homes or long-term care homes because the circumstances of their life require that they have some people to help them to do things, but they're still living. They're not just breathing. That isn't the goal. And while we might have some understanding of initial reactions when we didn't know what we were dealing with and the world appeared to be falling apart, it becomes more difficult to explain what we did and didn't do as the months have now turned into years, because we pivoted our attention and focused on a lot of other things. It's really important for kids to be in school, and it is, but we didn't make that same leap to recognize that those social interactions, all the arguments about why children need to be in school and learn in person, apply to why people in long-term care needed to see and be engaged with their family. And we didn't have that same urgency and imagination to solving this issue and to recognizing it. So this underlying societal ageism that exists out there really came into full focus during COVID. The challenge for many is that it's difficult when this ageism, to a large extent is born out of because we care, or paternalism or maternalism. And that makes it challenging to deal with. I hear from everybody. So, it's interesting. I hear from people who enjoy where they're living in nursing homes and long-term care, and their voice has to be respected too. Everybody doesn't feel it's a terrible place, but many do. And that has to be equally respected. We can't just pivot when we hear complaints to bringing out all the people that are happy, as though that negates the people who are expressing their concerns, because that's effectively what we do when we talk about issues and challenges, and the response is, well, that isn't everybody, ergo, it doesn't matter, right? So we need to think about that. So this issue around, we know what's best, we want to keep you safe. There is, and apologies to you, Stephen, but there's a gender divide out there. It's not absolute. Nothing is ever absolute. But when we look at the gender of the people who engage in our surveys and look at what happens at a national level, who's going to visit the people in long-term care, it is overwhelmingly the women. Who's caring for them professionally or in a paid function? It's overwhelmingly women. Part of that is their low-cost jobs, but even within the world of low-cost jobs, it tends to be more dominated by women in older people. And you can also see who has that person in their life. So part of the challenge is some people, if you just look at the numbers, most people, most Canadians don't know anybody in long-term care and never will. And this revelation about life in long-term care that came about because of COVID, that had people going, this is awful, this is terrible. Many of us were sort of, well, what did you expect? This is what it is. And so I do take inspiration from the fact that the response of Canadians was to be horrified and to say we have to do better. And I don't think it's a coincidence that we sent these strapping young CAF members into long-term care homes. I mean, these were young people who believe in training and believe they're invincible and are strong and healthy, and went into long-term care and could not believe what they saw, and said that it's quite something in the world of the CAF, the Canadian Armed Forces, for memos to get written and memos to get leaked. That tells you how strongly these people felt about what it was they were seeing, because they'd never seen it before. And so, you know, I think it was Megan who said, or well, oh no, it was in one of the chat boxes that came up, where somebody said we need the political will. The political will follow the public will. The government at the end of the day is the people. And if they don't do what the people want, they won't get to be government. The challenge is always getting enough of the people to want something. And that's the element that I believe has been missing in our language. We in philosophical or esoteric terms, we all care about older people and care about our granny and our mums, but we go about our day-to-day life, and for the most part, we aren't impacted by it. And then when we are impacted by it, we are overwhelmed by it. And that is certainly what we saw in terms of the people who engage with frail seniors, whether it's in the community or in long-term care. So these types of projects, such as Megan is undertaking, why they are so important is because what we know is, once we really understand what's going on and what's happening, we do care. And we do say it needs to be better. But we don't know what's really going on and understanding it. The issue of how we separated family members in long-term care, you know, I reflect on the global outrage there was against the American government when they separated children from their parents at the border. There were about 50, I think. I might have my number wrong. But there was universal global condemnation of separating parents from their children. Well, that's what we did in long-term care. We separated spouses and we separated adult children. And we separated people who were an integral part of their life. For some people, their daughter's in Ontario, they're in Vancouver, they're a widower. They didn't feel that degree of impact, but we didn't treat them any differently than the people who would have the wife that came every day, or the daughter that came every day, or the son that came every day, or almost every day. We took this approach that we're gonna keep you breathing. Now, we weren't able to keep everybody breathing, but what's interesting is, in terms of a death from COVID, we actually did not bad. I realize that's not comfort to those who lost a loved one from COVID, but it's important to understand, and I'm going to give British Columbia numbers, and they'll look similar in other provinces. We maybe did a little bit better here, so they may be more dramatic in Ontario and Quebec, but we had over an 18-month span of COVID, we tragically lost over 800 people, just over 800 people in our nursing homes. But during that same period of time, we lost over 10,000 people in nursing homes from diseases other than COVID. So we weren't able to prevent people from dying. We may have prevented them from dying from COVID. We don't know that. What we do know is we absolutely prevented them from spending time with their loved ones at the end of their life. And one of the stories that was told, and I've heard this many times, is the trauma of the loss is less of an impact than the trauma of how the person died. They died alone, or they died, and for the 8 months before they died, I could barely spend any time with them. I think most of us accept that the end will come to us all, and most of us accept when our mom or our grandma or spouses in long-term care, that the time their end will come. What we are traumatized by is how they lived those either final days, weeks, and sometimes months, and now sometimes years of their life in this environment that completely strips people of their autonomy. And with that goes stripping them of all of their dignity. Your sense of dignity goes hand in hand with your sense of autonomy. And no clearer illustration of that can be given between somebody who is a slave and someone who is emancipated. The dignity is, I get to decide when I want to get up. I get to decide what I want to eat. I get to decide what I want to watch on television. Now, many of those things you no longer get to decide in long-term care because you're living in a congregate setting. But I get to decide who comes into my home to visit. We didn't have to take that away. We could have applied to keeping people in long-term care connected with their families. We could have applied much greater imagination to how to achieve that safely for most people. We took a very clinical blanket approach. We made no distinction between the fact that some people would have no visitors. Some people were only going to get a visitor once a week. Other people had somebody who came every day. We didn't say, okay, well, you can take the slot of the other, your visitor can take that slot because, we didn't do any of that. We said, we are going to make every decision for you. And then the other underlying thing, and this is, I think, across the whole clinical community, the whole medical community, we completely dismiss the value of that familial relationship. We believed that we, as clinicians, could provide for all that was necessary, because to live is to breathe. End of statement. And we would not acknowledge that a family member being there at mealtime and helping to feed their wife or their mom was different, for some, not all, than if a care aide was there doing it. We didn't distinguish between that. And I think we've got a lot of soul searching as a clinical community, medical community, to do around really what was the underlying message, because we're going to deflect to, we had to do it to keep them safe. My argument is that argument, that was a valid argument in the first couple of months. But when we had to get all of our PPE equipment and all of that, right? I mean, we have to remember where we were then. So, a reasonable person will say, okay, we can, but that doesn't hold. Remember that, certainly here in British Columbia, the first response to the pandemic in long-term care was close to visitors. The response was not have everybody wear a mask. The immediate response wasn't up the cleaning protocols. The immediate response, that wasn't the immediate response. It was closed to visitors. That was so we need to think about what that message was that we gave and what that means to the people who lived there then and who are living there now. And I think if we, many of the problems in long-term care it'll be a cascading effect. They'll get fixed once we say the people living there have the right to demand certain things, because they'll demand the things that are needed to fix the system. They'll want the people taking care of them to be well paid. They will want them to be there when they need them. They will want it. They will want to have the same people so that they can form those kinds of relationships with them. They will want to have greater autonomy over when they decide they want to get up and, deciding when it is they want to eat. And they will absolutely demand to be able to see their most beloved family member when they want to see them.
Isobel, I'm sorry, can I get intrude? I'd love to get a couple of quick questions in here at the end.
I will conclude with that, Stephen. So,
thank you so much.
I will turn it over to you. So thank you, everybody, for listening.
Yeah, and thank you. And we'll run a little bit over time, so I hope everyone can stay with us. We do have two very brief final speakers, and because we're being joined right now by two Ontario members of the provincial parliament. These speakers are John Fraser, the Liberal representative from Ottawa South, and Catherine Fief, the NDP representative from Waterloo. Please welcome.
Good afternoon. I was just writing you a note. I'm sorry, I thought the event was going to end at 5 o'clock, but I have a very short statement. I really just want to thank the organizers, Megan Davies, for creating this creative and exhibit and providing an outlet for long-term care residents and family members and care workers to share their stories. And I think that we can all agree that art and the creative process actually helps people to reflect on our grief and process emotions. So I want to say that first off. And it's going to take some time, but for legislators like myself and MPP Fraser, we need to invest in the time, in the staff, as has already been pointed out, who are primarily women and racialized. And there is a responsibility, a deep responsibility, to provide some accountability to families and to those healthcare workers. And I think it's really telling that today, the Minister of Long-Term Care has actually just resigned about 2 hours ago here in Ontario. And also during this past week, there have been 142 new outbreaks declared in long-term care homes, infecting 1,319 residents and 506 healthcare workers in 1 week alone. And there are 389 active outbreaks in Ontario's long-term care home. 43% of our long-term care homes right now are an outbreak in Ontario. We should definitely not be here. I'm actually without words, which some of you will be surprised by that, because as politicians, we usually can talk our way out of these issues, but not this. I think we can all agree that there was no iron ring around our long-term care homes. The isolation piece, which continues today, exasperates the disregard for quality of care. Any reasonable person would conclude that caring for those who are aging is one of the core businesses that we should have as any government of any party of any stripe. And what we have seen in this province is a perfect example of ageism, as Isobel had mentioned, coupled with the privatization of our long-term care system and our healthcare system. So this was the perfect storm. And I had some sense of how bad things were in our long-term care homes, because I had brought forward a piece of legislation in 2018 called Till Death Do Us Part. The legislation was meant to keep married couples or same-sex couples in partnership together as they age, and not separating them once they hit long-term care. And in my advocacy, I ran up against brick wall after brick wall of a variety of bureaucrats and system leaders, if you want to use that language, who said this was a nice concept, but this is not how our system works. And so there was definitely a complacency prior to the pandemic taking full effect. And at the time I said, well, this requires a systemic change. And I think that today's session really gives us an opportunity to explore this question. Is our long-term care system cold and callous, a system by design, or is it by neglect? And certainly political will is needed. Strategic investment that dedicates every dollar to the care and to the people who are doing the care. as a major focus on a go-forward basis, but also removing the profit agenda and putting people first is something that I'm very keen to pursue as a New Democrat, as an opposition member, and certainly as the finance critic for Her Majesty's official opposition in Ontario. So finally, I just want to thank the people who work in those homes. And even through their exhaustion, just a moment of hope here is that they have become politically active. They are holding politicians to a whole new level of accountability, which is good, as they should. And seniors also are now in my office saying, what can we do? Like, where do I sign up to design a system that is truly about dignity for seniors and for those who are in long-term care who have disabilities? And how do we move forward from this in a responsible and a place of compassion? And then finally, I just want to say, I mean, there are the stories that have come forward through this exhibit and through today's launch really align with what I've seen as a member of provincial parliament. And I carry one woman with me everywhere in all of my conversations, because she will never recover from her grief of seeing her mother pass away in long-term care and not being there for her. She will never have any peace until the system is reformed. And that's what keeps me going as a legislator, and it helps me keep up that strength. And today's launch also is inspirational because it means that we can create a whole movement across this country for quality care for seniors. Thank you very much.
Thank you. And John Fraser, you're muted.
It had to be the one that was going to happen to. Thank you very much. And I just want to echo my colleague, MPP 5, Catherine, said in terms of thanking Professor Davies for, and everyone who contributed. Stories are really important. They change things. And creating permanence around stories, making sure people see them and hear them, that helps change. COVID, I think people have heard it called the great revealer, pulled back a curtain. And what we saw, we didn't like. And what we saw about the systems that we have, we didn't like. What we saw was, as I think I heard earlier, keeping people alive, but not living. And that second pandemic of isolation, I think is, obviously it's more horrific than the actual disease that created or exposed it, because that pandemic of isolation exists within our society right now and within our long-term care homes. So it's really important that people keep this going, because one of the things sometimes when they pull back the curtain and you look at it, you look away. Mm-hmm. And that can happen. And so we can't look away. And it's important to keep that memory alive to drive the change that needs to happen in long-term care across Canada. And it's not just in long-term care, it's aging and how we see people in society being part of a community as they age. And I'll just leave it at that. Thanks again.
Thank you very much. Thanks for joining us, and thanks for your comments. We really are more or less out of time, but maybe I can throw one question from the Q&A to anyone who spoke today. Maybe it's more a question directed toward Isabella or Megan, who could respond. But one of the early questions that came on here was, do we need to distinguish between public homes and private for-profit homes? And if we do that distinction, I don't know what different actions need to be taken, I suppose, in those different contexts. This is you've got 2 minutes, go moment. Okay,
well, I'll throw something in. I mean, I think the research is clear that for-profit, there'd be more problems during COVID. Infections, not always, but tended to cluster in for-profits. And I'm sorry, but logically to me, care of vulnerable people, many of them disabled people, to be done on a monetary basis just actually doesn't really make sense. And that's there probably are some nice for-profit places, I'm sure there are, but vulnerable people and stockholder, people that you have to deliver a balance sheet for at the end of the year, I don't think so.
I don't know if Catherine wants to say something.
Go ahead, John.
Yeah, so I just, I've been around this for 20 years, not as an MPP, the last 9 years, almost 9 years as an MPP. And I'll have to say for-profit care, up until this pandemic, I thought, well, this is something that we can live with. I've always favored not-for-profit care. In my riding, all I have is not-for-profit care. I said, look, this is something we have to do to build it, because it is the easiest way of doing that. You offload debt, you offload debt off the books, and corporations, it's easier for them to build these things. But the reality is they become disconnected from community. And I don't think they have a place anymore in our long-term care system. I just believe that that what needs to happen is we have to take ownership of it as a society, as a community, as governments. And we have to empower and enable communities to care for their elderly by making it easier for them. We don't make it easy for not-for-profits right now. And that's a big change that has to happen. That's a hard change. It's a lot of toothpaste, and I'm sure Catherine would agree, to put back in the tube.
Yeah.
Right? But we have to go in a different direction because we can't stay in the same direction.
But just finally, just very quickly on that, sorry, the not-for-profit sector is ready to be part of the solution. They are, and those homes are in community. They are smaller, they're not institutional. And if we empower them, and that's a political will question. It really is. But if we continue to see people's illness and as they age and bodies as a profit center, then the quality of care will not be there, because there's not enough money in the world. There really shouldn't be a lot of money to be made in long-term care if you're doing it right. If you're nutritional, if your menu is quality, if your programming is quality, if the capital and the infrastructure in the home is quality, there shouldn't be a lot of money to be made there, right? So a huge new direction has to be made in Ontario for sure. And we have a responsibility to use the research, Megan, as you pointed out, and base public policy on that research and that evidence.
I think I just want to caution that we have to remember there's a difference between where we go in the future with long-term care that may be built in the future and the reality of today. Because the reality of today, I'll use British Columbia as an example, 2/3 of our long-term care sites are contracted for by the government. About half of them are not for profit, but about half of them are for profit. And I think in Ontario, in fact, even more is not provided for the government. So what are we going to do with those care homes today? So I think one of the things, Catherine, you're quite right. If we properly manage the contracts that we have, because we've got to deal with these tens of thousands of people currently living in long-term care, and their life has to be better. We've got to manage the economic incentives differently. It shouldn't, right now, the economic incentives for funding in long-term care in BC, and it's not dissimilar in Ontario, gives a sum of money to an operator to provide a basket of services. And whatever they can save from providing that basket of services, they get to keep as their profit. We've created part of the problem by not explicitly acknowledging profit. We would be better off to say, we're going to give you $1 million and you have to spend that $1 million on the food, the care, and the supplies, every cent of it. And if you do that, we will give you $100,000 in profit, 10%. Right now, what they do is they take that $1 million and they create their $100,000 profit and then some by finding the cheapest products, which may be inferior, they may not. They are absolutely finding the cheapest labor. They are either doing it by having less of it or paying the labor they have less, or a combination of both. So we've got to, I mean, it's not as heart-rendering to talk about it, but what I worry about is we cannot forget the huge number of units, beds we have right now that are contracted, and we've got to deal with those. The model for the future, that's different, because I think that if we get the incentivizing right, you're right, the private sector will slowly recede. It won't be enough. The not-for-profit will come in, and public ownership will come in, and the private sector will recede. And for the politicians who say, oh, well, we got to be careful because they're all going to say, I won't do it anymore. They're not. Right? Ontario did come up with something just on this last point, the model where separate the real estate from the operating. That also has, because that is another problem. We've confounded two things that are, as Megan says, incongruent with each other, right? The private sector, the real estate, okay, you can get that. The care, we've conflated. Anyhow, I've said enough.
Thank you very much. Maybe I can give a last word to Megan, if you have a last word, Megan.
I think I just saw a message that we can go. Stephen, I don't know if you noticed.
A bit longer. Oh, okay, yeah. We can, but we're losing bodies. But
yeah, we are losing bodies. But some people, we may want to have another question, and I'm wondering if the other panelists would like to join us, as there may be questions for the family members.
Yeah, I'm just going to have to jump out quickly because I've got to get to another meeting, and I just really appreciate you giving me this opportunity. Catherine, it's nice to see you again this week.
Perhaps if you just take another question, Stephen, and then
sure,
email me if they'd like to.
Yeah, and of course, I'll just remind that there is the website. There will be future presentations of this project, including, we hope, live and in person at Kwantlen Polytechnic in a few months anyhow. But yes, if there is another question, I know there was one comment/question that I find very interesting, but that's well, it's phrased as a question: do you have a plan to turn from this magnificent work into political action? Or maybe I'll just rephrase that a bit. And how do we move from this kind of thinking through, memorializing, recording, responding to this crisis, and taking some kind of political action? I mean, the first thing that comes to mind is simply the petition it's Bernadette and Antoinette's petition that we've had in the chat. And Christine's dropped in there a couple of times, I believe. And obviously that's one place to begin.
Certainly, the petition, which was written collaboratively between 3 family members and myself, is a really interesting starting place, because it goes out in the world, attracts interest, it can build community. The website will have a teaching portion, and I've already been asked to do virtual tours for a gerontology class, social work class at North Island College in March. To me, education is a form of activism. And I think it would be interesting. It'll be interesting to see what happens. And activism can take many forms, but I totally take the point that's being mentioned here today, that unless we push politicians, change is not going to happen. And so I take quite an activist position on this, and really would be delighted if the project became a focus for activism.
That's great. Maybe another question then, which is, please speak about why you think the politicians and public health in BC, as an example, chose the isolation approach that was spoken about earlier, early on, and also comment on what's happening now. Excellent project and comments, someone said too.
Oh, that's the question for Isobel, I believe.
It kind of is.
Okay, Sorry, I was trying to read the chat box, so you'll have to repeat the question.
Yeah, sure. If I can. Yeah, it's right here. So please speak about why you think the politicians of public health in BC, as one example of this, chose the isolation approach early on, and also comment on what's happening now.
Okay, I think everybody chose the isolation early on, right, across the country in the first 2 or 3 months of the pandemic. We continued. We did have the most restrictive policies in BC, and we've got them again. I don't know. I think people are well-intentioned. I think they do see it as a way of keeping people safe. And in this latest round, I think that, again, they view the family members as a burden for staff to have to screen them before they come in. And it goes back to my other comments. If we wanted to figure out how to make it work, we could once we got through the first 2 or 3 months. Because one of the things to highlight is once in the first part of the pandemic, British Columbia did do better in long-term care than some other jurisdictions for a variety of reasons. By wave 2, when we were now having the most severe visit restrictions in the country, we didn't perform any better. Our proportion of cases in long-term care relative to total cases was the same as it was in Ontario. In wave 2, not wave 1.
I guess I would add to that we are so risk adverse about seniors. You know, if I was in a care home with dementia, I would be told that I could not use a sharp knife.
Yeah.
The reality is, I've spent a lot of hours of my adult life cutting up apples for kids, making supper. That would be a very overlearned skill. And but that's a total example of that risk adverse culture that pervades long-term care facilities. We had smaller ones where people knew each other, where residents and staff could have relationships. Staff would have a sense of what risks were appropriate. And, risk taking, around wheelchairs is a major one. But anyways, with long-term care facilities in the pandemic, the impulse was to keep people safe. But risk is always like a concept you need to weigh.
Yeah.
And that's the point. What were we keeping them safe from? That's why I was contrasting. I wasn't diminishing the 800 deaths from COVID. I was contrasting it to the 10,000 deaths that weren't COVID during the same time, right? Again, back to Megan's point, risk aversion.
Yeah, yeah. As you said, it's not whether people are going to die or not. It's how they're dying. Those are decisions we're making for people. Yeah. Maybe one last question, which is there's a question about what about other provinces? We mostly focused on BC and Ontario. This person asking the questions coming from Alberta, where for-profit seems to dominate. So you did mention just a minute ago, Isobel, that the trends kind of are, or the decisions made, the processes of isolation and that sort of thing were pretty standard across Canada. But are there any differences amongst the provinces that are worth noting?
It's difficult because in order to really compare, you have to have confidence you're comparing apples to apples, and definitions have changed and everything. I mean, we will be able to look back, but even now we're in the midst of, how many cases to declare an outbreak and what's getting recorded and all of that kind. So it's difficult to say. What I would say is that in general, across Canada, in your larger provinces, Ontario, Alberta, BC, you have much less public ownership than you do in your smaller provinces, like out in the Maritimes and in Saskatchewan. Quebec, large public ownership and didn't have a good experience in wave 1, but that's a difference you'll see, large province versus small province. Size also will be reflected in that, and that will impact all these COVID numbers as well. So, that's a long-winded way of saying it's difficult to compare a lot at this point.
Yeah. Did you have anything to add, Megan?
Not really to that. Like, I mean, I think that, as Isobel says, there's a real variation. quite different in the Maritimes. But yeah, I think that eventually COVID got to all the provinces, and there were serious outbreaks and mass death, which is a kind of phrase that you would flinch at, but it is appropriate to look when you're talking about Little Mountain or some of the places like in different parts of Canada and certainly in Quebec. So I think that the flaws, the deep pre-COVID flaws, exist across Canada, and the rethinking needs to happen right across Canada. And it's complicated, you know, it's not an easy process, and but I would hope in some small way that this project would help us think about a system of elder care that we would want to experience as we age, because this is about us, you know. It isn't just about our parents and grandparents. It's about us, and there's no guarantee that we might not end up in long-term care facilities.
Yeah, exactly. Well, thank you so much. And this is probably a good point to intervene and wrap up. So thank you everyone who attended today, and many of you have stayed on right here to the bitter end. That's lovely. Thank you to everyone who spoke. Thank you especially to the family members, people who lost family members to COVID and spoke today, and the advocacy and work you're doing is very moving and much appreciated. And thank you, Megan. This is an incredible project, and it's going to continue to evolve and be available to people. So I'll direct everyone's attention again to Megan's website, and which you'll find the chat several times, I think, if you scroll up, and we look forward to more actual one day in-person opportunities to see these chairs and see the installation and hear the audio. And it's just so utterly moving. So thank you very much, everyone. And thank you all our wonderful tech supporters who have done some overtime here. Thank you all.
Okay, and thank you, Stephen.
Take care, everybody.
All right, have a good day, everyone. Bye-bye.